Take a deep breath. Press. 1, 2, 3, 4, 5. 2 breaths and 6, 7. Good. Release. Do 3 of these. Deep breath. Knee lock and press. 1, 2, 3.
Okay, so now we're going to see how you feel to start with. So I'm going to have you take a stand up, Tim. And tell me, did that cause you any discomfort?
Oh, yes.
It looked like it did. What would you say your pain level was when you felt that?
About 8.
About an 8. And we're going to try squat. So step forward 1. And then I want feet shoulder width apart. Yep, there you go. And hands out in front. Try a squat. How low can you go?
That's it.
That's it?
Yep.
And did that cause an 8 in pain or more?
No, that's as high as you can go.
Oh wow. That's not good.
No.
So we're going to try the stairs as well as you can. You can use the handles if you need.
Okay.
Try to go tandem. If you can't, I understand. But at least give it a go. Oh, oh, oh. Okay, don't. Yeah, that looked really hard.
Yep.
Down was really tough. Do you think up would be better?
It's not much better.
Well, let's give it a go. Let's see what happens.
Alrighty. Tandem also.
Tandem if you can. If you can't, that's fine. All right, no more tandem.
Oh, my knee just goes right out from under.
Oh, it just goes right out from under you. So it's weak, it's hurting.
Yes.
So what would you consider a significant result today? You're starting at what, 10?
Yeah, at least.
And if you went down to what would be significant for you?
Oh, just for today?
For today.
Oh, if I could get it down to where it's like a 5 or 6 would just be awesome.
That would blow you away?
Yeah.
Well, let's see what happens.
That would just really make me happy.
Thank you, Tim.
You're going to lengthen this muscle that does this every time you take a step. Okay? So take a deep breath. Pull your knee up. Go. Pull up. 1, 2, 3, 4, 5, 6, 7. Reach down. Yep, reach down to the floor like that. Good. Deep breath. Pull your knee up. Pull. 1, 2, 3. Pull your knee all the way up. Don't bend it. Pull the knee up. And relax. Down again. Good.
Tim, you're all done.
Wow.
The first thing we're going to do is I want to have you walk all the way to the end and come back and just tell me any changes that you're feeling.
Okay.
Okay, good. Doing your lengthening for the hamstrings now. Good girl. And just put your nose down.
Where's that limp?
The doctor took it.
Oh, yeah. You got Tim's limp in your pocket, Dr. Davis?
Look at me. Oh, yeah.
I was totally expecting you to keep limping.
I feel wonderful.
Feels good.
So what is different?
I can actually move my knee and I can walk.
It was stiff before?
Yeah,
Okay.
it was just painful.
And then how's the pain level right now?
Pain level is about maybe a 4.
About 4?
Yeah.
What you say?
Yeah.
Let's go outside. Let's try the other exercise. Tim, you're done.
Awesome.
All right. I'm going to have you sit down. We're going to see how that feels. What does it feel like sitting down?
Feels normal, like it should.
Okay. And then let's stand up. You did that very strong.
Yes.
That was very strong. So one step forward. Let's try a squat. Let's see what happens when you try a squat.
Okay.
Oh my God. Oh my God. I didn't expect that.
Me either.
What pain level did you feel doing that?
About a 5.
About a
Maybe
5?
6.
Okay, that's about what you were saying. That's just the first treatment.
That's mostly into the muscle.
And that's in the muscle, not in the knee. All right. Can we try these stairs? We'll see what happens.
I'm hoping. I'm still a little wobbly.
Yeah, hold on to the railings.
So, and you want me to 2-step?
Let's try it. Let's see what tandem does. Oh,
Still
still a little weak, but
yeah.
that was a lot better than the last time. You almost fell all the way forward before. If you want to try it, I'm not forcing you to do it, but if you want to try the tandem going up, let's see how it goes.
Let's see how it goes.
Oh my gosh, that was almost seamless.
Yeah.
Oh my
It
gosh.
was pretty good.
Well,
It's
what?
just coming down is hard.
Yes, coming down is you actually have gravity working against you as well. So, and that's just with the first treatment. We haven't done the therapies that go with this too. So, what do you think?
Oh my gosh.
So you're down to about a 5 with your highest pain level with what we just did.
Between 5 and 6.
All right,
Yeah,
we got it.
with the steps.
We did it.
Yeah.
All right, let's keep going.